Once it tells me it's recording, good. So thank you so much for everybody, joining us today. Leading through change, post-pandemic travel, we talk about this topic of travel, right, as if it's some far-off, distant land that we never know if we'll experience again, right? But in order for us to get back to travel, what we understand is that there are things that we need to put in place and responsibilities of everybody to, participate in really leading through this change, right? So that we can all have an opportunity to get back to travel. I'm really excited to, have the two panelists with me today, and I'll explain who they are and all of their expertise in just a moment, but let's get through some housekeeping rules first. So webinar is going to be recorded. We are going to have a 45-minute session and then a Q&A at the end. Feel free to ask questions during the webinar though, and then we can address them at the end. We have a lot of good information to provide to you today, but we also want to make sure we get to your questions because this is a discussion, this is a collaboration as well. And we want to make sure we have an opportunity for everybody to participate in that. Slides and the recording will be available. We'll send those in an email following the webinar. And if you could please, you're going to receive a survey right after the webinar. We would love to hear your feedback. We had a webinar a couple of weeks ago, and part of the feedback was, we love this topic, let's dive in deeper. So that's exactly what we're doing today, is we're diving in to some of the laws, standards, regulations that are surrounding travel, and then just best practices and what we can all do to help, speed that along so we can all get back to traveling. So we have a couple of experts. My name is Ashley Davis. I'm with Punch Alert. I'm the VP of Community Engagement. I love to just bring folks together, work on collaborations and discussions and just getting information to people and providing resources. And we have so many experts out there that we are trying to do, a webinar series, again, just to dive in deeper and to bring those experts to the forefront and get your questions answered. So that's really my passion, is just that collaboration of the minds and the transparency of information and the right information. And of course, right next to me, I have the wonderful Stacey Porter with Porter Global Security. His bio is right there. He's been 20 years of federal experience managing security personnel in the aviation and security industry. He's been a liaison with the public and private sector organizations at the local, state, national, and international levels. He just brings a plethora of experience when it comes to vulnerability assessments, mitigation, security planning, threat and risk assessments, and investigative management operations. I have just thoroughly enjoyed getting to know Stacey, and I would absolutely recommend him if you're looking to open up a business or you're looking to understand what those risks are and what you can do to reopen and get people to come back to your establishment. And then, of course, our subject matter expert today, Michelle Dawkins. She's a certified trainer for over 25 years. She's spent the last 15 years specializing in occupational safety and health, both as a trainer and consultant. She has a passion for worker education and training. Her experience covers several areas, including construction industries, chemical companies, environmental remediation, manufacturing, Department of Transportation, shipping and handling of hazardous materials, risk management, and automotive and related industries. And then, of course, you can see some of her certifications there. But she is just so passionate about safety and security, and that is exactly why I wanted to bring her to the forefront today to share some of that experience, because I don't know, Michelle, who has more passion for safety and security. It might be a little competition between us, but what I love about it is that we're fighting the good fight together, right?
Yes, exactly.
So I appreciate you for that.
Exactly.
And and so for without further ado, I want to get straight to the meat of it. I'll hand it on over to Michelle, and Michelle, just let me know when you need me to move the slides along. But thank you so much for both of you joining the call today, and I look forward to hearing this information.
Oh, you're welcome.
Thank you so much. And I'm grateful to be here with both Stacey and Ashley. I think we make a great team. Because we all three of us do have the passion for what we do. And right now there's a common bond with everyone, you know, looking and asking questions about what's going on with COVID. So what I'm going to be doing is just presenting some of the basics, because one of the things I've realized as I've been doing training over the last couple of months is that a lot of people don't know just the basics about COVID. There's so much information that we've been inundated with through news, through social media, some true, some not true. So just trying to go back to the basics and give you an understanding. This particular training is a part of the National Institute of Environmental Health Sciences, where I'm doing some consulting work with one of the organizations out of New Orleans, the Deep South Center for Environmental Justice. So, you know, just trying to put together some information so that as we begin to travel, it is that season now. We've been through isolation, we've been through all of these other things, and we want to make sure that people are feeling comfortable, but they also have knowledge, you know, that they're doing their part in this thing so that we're not spreading or coming into contact with this particular virus. Next slide, please. Uh-oh. Next slide. So some of the, did it skip? It looks like it skipped. So some of the basics, we know, you know, the different signs and symptoms: fever, cough, trouble breathing, but it's not isolated. I mean, it's not just these particular symptoms. According to some of the medical personnel, there's other symptoms. The symptoms now are growing. And one of the last calls that I was on, there's some people are being affected, their internal organs, they're having difficulty with their kidneys, they're having other difficulties. So now the symptoms seem to be becoming more widespread. So we want to make sure that we understand that, you know, if you're having any kinds of difficulties, it does not necessarily mean that it is COVID, but you want to get checked out, because it's not just the trouble breathing. We've heard things like people losing their sense of taste and smell. There's a multitude of symptoms. I know when one of my family members got sick recently, he complained about chest pain initially, and then he started having problems with his muscles. He said that he was at a point where he could not even move. His muscles kind of just froze on him, and he was standing in front of his bed and could not even take 2 steps to sit down. So it's going to vary from person to person, and that's what we're hearing overall. The average incubation period is roughly about 5 days, and 99% of the people exhibit some kind of symptoms between 12 to 14 days. And this is why they're encouraging people to, you know, isolate themselves for that amount of time, because that's usually when the symptoms start to show. But understand that only 80% of the people, only 20% of people show signs. 80% of the people are asymptomatic. So that means that once again, when we're out and about, 80% of the population are showing no signs, but they may have this infection. So what do you need to do? You need to be more vigilant and follow all of the guidelines that have been given. Next slide. These are some of the additional symptoms: shortness of breath, fever, chills, muscle pain, headache, sore throat. The loss of taste or smell is another telltale sign. So these are just some. And so when you think about people that you've heard or that you may know that have had some symptoms, there are some other things that may show as well. Next slide. So we want to make sure that you are cognizant. So what are some of the sources of infections? Droplets. Droplets are produced when a person coughs, sneezes, or speaks forcefully. This is one of the reasons why they're encouraging that we wear masks. Masks are designed to protect the other person, not necessarily you. Droplets from an infected person can travel to the mucosal areas of your body, your eyes, your nose, those already, you know, moist areas. That's how this infection is being spread. So you want to make sure that you do the physical distancing that's being encouraged. We're going to start to see and hear more, I'm sure, about this as the numbers are increasing in what I think today it was 18 states now have reported significant increases in the number of infections that they're seeing and the number of hospitalizations as well. So as the graphic shows, you can see that, you know, when you talk about not being distanced, how far these droplets have the ability to travel. Next slide.
And Michelle, before we go to the next slide, can I add to this?
Sure. Jump in anywhere, Stacey.
Okay, yeah, just you know, looking at this slide, I know a lot of you, and looking at this one as well, a lot of you are concerned about how will this affect me on an aircraft. Now, one thing you have to keep in mind, especially here in the United States, and I'm sure they're doing this in other countries as well, most of the aircraft, they're working with companies to disinfect the aircraft, where they're wiping down, they're doing a defog. And that defog or wipe down, it's not just sitting on top of the surface, it's actually wrapping the surface as well if you use the proper defogging systems, where it's getting under the seat, the tray tables and everything. Now also your aircraft, we know it's a tube and the air is circulated, but most of your aircraft use what's called a HEPA filter. Right. And you see a lot of those similar HEPA filters being used in office spaces as well. Now, it's not 100% that will catch all particles, because you still have that 5% where your partner beside you, in front of you, or behind you could possibly cough or sneeze and still emit those droplets. So again, the HEPA filter is not 100%, but it's close enough. I would say probably 95% that it's catching those particles on that aircraft. And also, again, you know, the planes or aircraft should be wiped down, disinfected. If it's not, you should talk to the air carrier that you're flying on, or talk to the gate agent as you get to the airport and ask, you know, is it possible for me to possibly catch the next flight, where they should accommodate that. So I just wanted to add that in there, Michelle. Thank you.
Thank you. And I want you to jump in, Stacey, because, you know, you have that expertise, especially on in relationship to the airline industry and what's going on in our airports right now. So sources of infections. The other one is surfaces or objects, you know, and of course, when we're traveling, we're touching a lot of things. We're touching, you know, as we're going, the rails, as we're going up the escalators and elevators and things like that. Just remember, you know, the closer, the more enclosed an environment is, the more opportunity there is for, you know, something to be in that particular environment. So understanding that, once again, if you're touching, which you have to touch some things, but you want to make sure that you're constantly washing your hands as well. And we're going to talk a little later about, you know, the purpose of soap and water, you know, good old soap and water, getting back to basics, right? And, or, you know, if you can't access that, of course, having at least a 60 to 70% alcohol-based sanitizer. So making sure that, once again, if you are touching surfaces, that you're taking the necessary precautions and cleaning off your hands. Because remember, you know, we kind of touch our hands, touch our face, our mouth, and our nose, those mucosal areas, on a consistent basis without even thinking about it. So, you know, and I know one day I sat down and I just wanted to see how often I touch my face, and I do it, you just do it unconsciously. So, you know, if you're not washing in between that time and you're doing public traveling, then there's a real good possibility that you can infect yourself. So as Stacey said, there are some precautions that all of the airlines are, the guidelines have been set for them to do, but there's some things that we can do ourselves.
And to add to that as well, again, just looking at these two photos right here, I know in the United States, and I know we have folks on the call from other countries.
Internationally, yeah.
One of the things I will say, you know, most aircraft or companies, they're looking at handing out sanitizer as you arrive at the gate. If you don't have the equipment, they'll give that to you so you can wipe down your area on the aircraft. Also, a lot of the airline industries, they're giving out face masks as well. So I know here in the United States this week alone, the top major air carriers, Southwest, American Airlines, United, and Delta, they made it mandatory that everyone on the aircraft must wear a face mask. So you may say to yourself, well, I may not have my face mask, I forgot it. But again, they will provide that information for you so you can wear it. Now, if you do have underlying conditions, they understand that, they'll work with you. But if you're a passenger and you decide you want to eat your food and take 2 to 3 hours just eating food, then you may have some concerns with that. And we saw that yesterday with American Airlines flight. Our very first passenger was banned from flying on American Airlines because he refused to wear a face mask. So they are serious about these procedures now, and they've tried really hard to work with the federal government, but the federal government decided not to step in and let the airline industry handle that. So again, here in the United States, those are now the policies and procedures. I'm not sure how long that will go into place, but one of the things you have to keep in mind, if it's mandatory for you to wear a seatbelt on takeoff on an aircraft, they're trying to treat the face mask the same way as you treat the seatbelt on an aircraft. It must be mandatory for you to wear that. I know with Delta Airlines here in the United States as well, is that they've blocked all middle seats so you can practice that social distancing. Not only that, they're also flying their aircraft at 60% capacity. American Airlines flying their aircraft at 70% capacity. So they're doing whatever they can to assist with the social distancing. And also with the jet bridges, as you board the aircraft, they're no longer crowding everybody inside that jet bridge. They're doing piece by piece so they can hopefully practice that social distancing. So, you know, if you're traveling, as I saw earlier in the chat box, the gentleman who said he lives in Israel and he's looking to fly into Taiwan, before you do that, I would also advise pull up the information on that country where you're trying to go and look at the numbers. How are the numbers looking? If I travel to this location, do I have to quarantine once I get back for a certain amount of days? But if the numbers are high, is it really worth me flying into that area, or do I just stay where I am and possibly continue to do the virtual meetings like we've been doing? I know this is the vacation time for everybody and you want to get out the house, but you also want to practice safety measures as well.
Exactly. Good point, Stacey. And remember, you know, change is not new to us. Remember, after 9/11, we made a lot of changes. And guess what? We adjusted to them over time, because I remember pre 9/11 where we were able to walk all the way up to the gate. Well, we can't do that anymore. So this is no different. This is all about our safety and making sure that we all come through this unscathed. So just practicing, you know, wearing your mask, and doing the things, the guidelines that have been set forth with the distancing, physical distancing, and washing your hands, those are our new norms. And so in order to do this thing effectively so that we all don't end up sick and, you know, and God forbid, dying, we want to make sure that we adhere to the rules that are in place. This is a trying time for everyone, and especially our airline personnel. So think about them as well, because they are doing this. Their exposure is a lot more than just ours. For those 2 or 3 hours that were, or 4 hours or whatever, that were on the plane, they're going from place to place with tons of people. So we want to also protect the workers that are, you know, are taking care of our needs as well. Next slide. So sources of infection, the fine particles, like you see in this graphic right here, they're aerosolized, so which means that they're airborne. So according to what we know right now, this particular virus can stay in the air for about 3 hours. That's a long time. But with all of the precautions that are, all of the mechanisms that are in the plane, like Stacey said, the HEPA filters, filtration systems, the fact that they're using a fogging system, all of that is going to help to reduce, if not eliminate. So we want to make sure that you understand those things, but you have to play your role as well. Of course, when we talk about being in enclosed environments or where there's high concentrations of the aerosols over a period of time, and you have infected persons, then that may cause a problem. But we want to make sure that if everybody's practicing these rules and these regulations that are now being put in place, then that, you know, everybody's able to travel in a comfortable manner and get to where we need to go and still enjoy our vacation time. Next slide. So these are just some examples of why we wear masks. And if you take a look at the graphic here, the lower the risk, when you both have on masks and you're 6 feet apart, look at, you're tremendously reducing that possibility of exposure. And then as you go up, you know, once again, that exposure level increases. The higher the risk is when no one is wearing a mask. And you know, you may not be singing or talking hard or loud, but those particles are still just a natural part of what occurs when we do talk, and sometimes even when we just breathe. So the fact that you have the mask on, even look at the effect when you don't have on a mask and another person does. Okay, so look at these graphics, and I hope that they stay in your head when you try to determine whether or not you want to wear a mask, especially when you're traveling. This is very, very important. And evidence has shown that when people are, both individuals or when masses of people are wearing masks, the reduction rate is much higher.
And one thing I'll add to this, just a side note, as far as masks are concerned, one thing we have to keep in mind, although a lot of our states, the governors are saying, okay, we're going to open because we're in phase 1, 2, or 3. That's fine if that's what the governor of that state would like to do. But keep in mind, that's just for opening up the state. It doesn't mean we're in phase 3 of the virus. We're still in phase 1 of the virus, or depending on where you live. Again, we do have some folks on here from other countries. So pay attention to that. Just because you're starting to reopen, which, that's something that we have to get the economy back up and running. You have to also be mindful that those are two separate things. We're reopening because we're in phase 3, but we're still in phase 1 of the virus.
Exactly. And as I said, now with the numbers going back up, there might be a possibility that we may start doing some, going backwards and start closing some things back down. And what is that going to look like? So, those are all possibilities right now because, we've had a lot going on, especially here in our country, that are dictating why these numbers are going up. And so now we have to take a second look and say, hey, maybe we opened up a little too quickly, or maybe we didn't really enforce the wearing of masks and this, the physical distancing the way we should have. Other nations, other countries have done a tremendous job in comparison to what we're seeing right now. And so we may have to take a look at what they're doing that's working versus what we're doing and it is not working.
And just one thing for me, this slide really speaks to me as when I'm thinking about our shared responsibility in this, right?
Yes.
We may be thinking, well, it doesn't matter if it affects me, but the whole point is we have a shared responsibility for everybody, right? To protect everybody and truly not eliminate the risk, just lower the risk, right?
Exactly.
As much as we possibly can.
Mm-hmm.
So I really like this slide.
Mm-hmm.
And I apologize, there's a little bit of a delay when I hit the next button.
Yeah,
so.
So this is just another example, just giving you a picture. And of course, when we were doing the isolation where people were at home, there was no risk, absolutely no risk. So we have to think about, when they start putting these guidelines in place, they're getting this information from our scientists, from our medical personnel, and this is why they're dictating these things. Because when you look at the probability of contagion, it's tremendously reduced when you go down to the level where people were isolated. And so, and one of the things I did is I looked at countries where they did total isolation, or some of the cities and states that did total isolation, and their numbers are not like they are in other states. So some of us got it right and some of us didn't. But how do we now all come together so that we can really start having a greater effect on reducing the amount of contagion, probability of contagion with the residents that live in these different areas. So the mitigation is all about, defense. How do we slow the spread? Having a defensive mitigation, a defensive plan. So of course, preparedness, response, recovery. The three categories when we talk about mitigation strategies are the physical distancing, wearing your personal protective measures, taking those into consideration, and then also cleaning and disinfecting, and understanding the purpose of even cleaning and disinfecting, and understand that there are two different things, that you're not just cleaning, but you're both cleaning and disinfecting. And I think Stacey gave really good examples about the fogging, and Stacey, feel free to jump in, because this is what makes people feel comfortable as we get ready to go back out and travel, because it's not just the airline. People are traveling by bus, people are traveling by, rental cars. There's a whole process I go through. I have to rent a car this weekend. And when I go through, my daughters already know because, you know, I'm a microbiologist by training. So I go in and I already have, this was a practice I already did pre-COVID-19. I don't take that car, I'm wiping and, you know, I'm sanitizing disinfecting when I step into that vehicle already. So this is something that, you know, when you get ready to travel, you know, I'm thinking already ahead, some of the things that I have to do when I go to a hotel. You know, so you have to come up with your own mitigation strategies and plans when you get ready to travel. You know, I've already had a deep conversation with the hotel I'm staying in because I'm going there to do some training, and I want to make sure that I'm okay. And of course, I bring in my own, you know, processes, but I wanted to know what their processes were ahead of time as well.
And that's why it's so important for you to have a risk assessment conducted on your business prior to reopening. Again, that's my background. I conduct the risk assessments, and I'll go out and I'll assist you with what you need to do. I know everybody's following the guidelines of their state or the CDC, which is great. But again, there may be things you may be missing, just like if you're traveling to the airport. You may have people walking around the airport and they're not covered. They're just walking around, you know, uncovered as far as mask is concerned, and you're the one that's covered. So, you know, you have to keep that in mind. And that's where I can go in and assist you and say, okay, these are the measures that you need to put in place. Again, I can show you these vulnerabilities and hopefully they'll mitigate them. But I think right now with everyone reopening, everybody's doing whatever they can to ease the fear of the traveling public.
Right. Because Stacey, what happens like with the smoke rooms? Do they still have those areas, things like that? You know what I mean?
Most of your smoke rooms, they've gotten rid of those. And I want to say they may have moved some of them outside. I know they have areas for your pets, but as far as inside the airport, most of those are gone now.
Okay. Good.
And one thing I will add, as far as the aircraft, as far as drinks, you have to keep that in mind. Now, the flight crew, they're doing whatever they can, you know, make sure they're practicing social distance as best you can on an aircraft, of course. So don't be surprised if you get on an aircraft and beverages are limited, meaning, you know, some people may want alcohol. I know some aircraft decided not to serve alcohol anymore. So one thing I'll do when I travel, once I pass through security, I may grab something from a restaurant on the other side of security and take it on the aircraft with me, depending on how long the flight is. Now, I know it's hard for someone to be on a 6 or 7 hour flight and not have anything to drink or eat. But again, you know, those are things that the flight crew, they're weighing their options on how they want to do it. So again, if you have underlying conditions, you know, they'll work with you, but you're always going to have that person, if you give them an inch, they're going to want to take a mile. So just be mindful of that, that most of your aircraft, if you get on, they may limit the amount of beverages that they're going to serve as well as food.
Right. So what is 6 feet apart? Just imagine 2 large dogs standing nose to tail. And that kind of gives you an idea of how far apart you should be when you're, you know, standing in lines or whatever it is that, you know, that you're dealing with. You want to make sure that you stay that distance. So that's just a visual I found to be really good when you start thinking, because a lot of times people don't know, and certain places don't, you know, haven't had the ability to put the markings on the floor, or it's not conducive to the marking. So you want to make sure that you understand that that 6 foot distance is something that, you know, you want to adhere to as well. Next slide. And so remember, airports are doing their best. So, you know, there's pieces or parts of this that we have to take ownership of. So your personal protective measures, making sure that, you know, you're not touching your nose, your mouth, and your eyes, because as I said, those are your mucosal areas. Those are those moist areas that we know that the virus is looking for to get into. Viruses need a host, okay, in order to live, to survive. You want to make sure that you're utilizing cough etiquette. That's really key, because once again, this is how this gets out. Washing your hands with soap and water frequently, and knowing how to wash your hands effectively as well. And then wearing your face coverings when you're in public areas. So it is advisable when you're walking through the airport and things like that. This is a video, you know, unlike a germ, a virus needs a host to live, as I just said, because viruses have a weak membrane, but it can be broken down with soap and water. So we want to take a look at this video just to give you a really good graphic of what that means, because I don't think a lot of people get this.
homeowner's insurance, we've seen almost everything that can happen to your home.
Of course, a commercial, right?
You know that the best way to prevent the spread of coronavirus is to wash your hands. Wash your hands! Wash your hands! But why? It's because soap, regular soap, fancy honeysuckle soap, artisan peppermint soap, just any soap, absolutely annihilates viruses like the coronavirus. Here's how. This is what a virus, like coronavirus, looks like. It's a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, but when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap, and suddenly that fatty oil dissolves into the water.
I think it's the
And one thing I will say that, as Ashley mentioned, this is being recorded. So if you want to go back and watch the video, definitely feel free to do so. So we apologize for the buffering of the video.
Okay, we'll go ahead and move on.
Yeah, we'll move on. But that's a really good video, so hopefully you will take advantage of the recording. So decontamination of surfaces and objects, disinfecting and cleaning, and not just thinking of, you know, your mode of transportation, how you're getting there, but also where you're staying. The hotels that you're staying in, your Airbnbs, there should be some disinfecting and cleaning. So you want to kind of ask those questions ahead of time. I was very specific when I called the hotel. I wanted to know how knowledgeable they were with their cleaning routines, and I was able to get a lot of information. And then shared with her that I'm actually coming down there and I will be doing some COVID-19 training. So, you know, there's certain things that I'll be looking for and I'll be sharing with them. And I don't mind doing that, you know, so just knowing that when you go on vacations now, you really have to stop and really come up with your plan and what it is that you need to know before you go and start staying in these facilities. Next slide.
And this is part of the risk assessment piece that you see right here. You see the first and second picture. The young lady, she has on a face covering or face mask, and you'll see that a lot as you check into hotels now. You see how they're doing the disinfectant of the seats. She's wiping down the phones. It look like she's wiping down the wall as well. But one thing you have to keep in mind, you know, you have to also be mindful to do it yourself. Wipe down your remote control of the hotel if possible. You know, try not to touch it if you can't. The phone in the rooms, you want to ensure you wipe those down as well. I never use the hotel phones in my room because most of us have cell phones now, or I'll just go downstairs to the front lobby if I have a question, but I rarely use a phone in my hotel room anymore. But one of the things that's part of the risk assessment, again, is how often are they cleaning the rooms like they should? I mean, I know they changed the sheets, but as far as the disinfectant piece of it now, that's very important. And, you know, how often are your crew wearing their facial shields? How often are they, you know, wearing gloves, things like that? So they want to make sure they're protected because you're going to have various people from different walks of life staying at these hotels. So they want to be protected as well, since they may have families at the house that they have to go home to.
And another thing, they are doing very little housekeeping now. For example, if you stay an extended amount of time, they're not coming in every day and changing your sheets and or, you know, making up your bed and things like that. And they're letting you know ahead of time. That was one of the conversations. I didn't want them doing that. I rather, once I get in, then I have more control of that room because I'm taking care of the necessary cleaning during that, you know, during my extended stay while I'm there. So I want to make sure, and I do that. Like I said, these are some of the exercises I do already. Stacey, you're probably like me. When I go into hotels, I already have a regimen. A couple of my mentors are firefighters, so I walk the evacuation route. I mean, there's several things that I do before I even, you know, bed down, you know, or get comfortable in a hotel, just based on what I do for a living. And I'm sure the same thing is true for you, Stacey, because when you do risk assessments, there's certain things that kind of stand out for you just because. So I'm kind of really particular when it comes time for traveling and certain things that I do for hotels or Airbnbs, or, you know, in my, whatever the mode of transportation that I'm using, I'm already looking for certain things.
Yes. And Ashley, do you have anything to add to this as well with your background in the travel industry?
Right.
Yeah, just some of the things that I was thinking about, you know, points that you guys made about the workers that have to be out there, right? My father is he transports nitrogen and oxygen, and so he is considered an essential worker.
Yes.
And there are times where he has to travel down the road and stay at a hotel. And I know, you know, he drives, you know, for 10 hours or whatever it is, and then he gets to the hotel, and then he is frantically cleaning the heck out of the hotel room, right? Because, you know, he knows it's important to do so. He may be extremely exhausted, but he knows that he needs to wipe these things down, and he has this whole regimen that he goes through to make sure that he's keeping himself safe, but also those other people. Not that he thinks he's been in contact with you know, a lot of people that have been affected, but just the thought of knowing that if you're carrying it without knowing it, or if you've been exposed without knowing it, and then you're spreading it to someone else because you are too tired to wipe something down, you know, before, you know, you settle in or whatever, you know, he does take all those proper precautions. And so I just know firsthand that it's definitely something that we are going to have to get into the habit of. When we do, you know, get back to traveling. I think that it's important anyways, just to be clean and sanitary and not pass along germs if we don't have to. So that's just what I wanted to say about that. But.
And Ashley, I think those are very good points, because we have to take into consideration when we leave after whatever amount of time we stay there, that personnel still has to handle the laundry and the trash and all of those things. And if we don't know, you know, if you don't know if you're positive, just think about that next person. And is their health compromised in any way? And then who are they going home to? So, you know, we have to see this chain and understand that we all have to take part in this, because we don't want somebody to become infected because of what we didn't do. And then now they're passing it on, you know, when they're going home and taking care of maybe their elderly parents, for an example. You know, so understand your role in this. This is all of us coming together and saying, you know what, we're going to make sure that I'm going to make sure I do the right thing so that it's not being passed on to the next person. So that's really good.
Exactly.
So this is for those of us who may decide to drive, understand that all of the rest areas are no longer open. So you got to have a plan. You know, traveling now is going to be just a little different or a little challenging, because you got to have a plan. What are you going to do if the next rest area isn't for 46 hours? You know, what does that look like, especially if you have small children? So you really want to start, you know, you got to make phone calls. You got to, you know I have AAA, you know, and they're wonderful when it comes to stuff like that. You know, not do they only tell you, you know, where what work on the highway, DOT is working, but now they're going to have to tell people, okay, you won't have a rest area, so, but you may want to do this, or you may, you know, have to utilize like a McDonald's or, you know, a facility like that. But if they're closing early, you know, you really have to think through your travel plans, is what I'm trying to say. And for those truckers, you know, that was very challenging, because as Ashley said, they are essential workers, but they were having these kind of challenges out on the road. They were going, you know, these guys drive for hours, and then they're trying to go and utilize the restroom, and they can't. So, you know, and they're on time guidelines. So that becomes very, very difficult. So we want to think through this whole process of how is this changing in our new normal, and what role do I play in this, you know? Next slide.
One thing that I was just going to say about rest areas is the state of Arizona recently allowed for or permits, I guess, for the food trucks to go and set up at the rest areas to provide a source of food for the truck drivers, because with everything closed down, you know, they weren't able to properly be fed. And so I thought that was pretty interesting that, you know, and I don't know of any other states that did that, but I know California didn't, because my dad drives his truck all around California and Oregon and Washington. And he was like, wait, I want a food truck at my next truck stop. So things might change in the future. Who knows,
Yeah.
you know?
I mean, I kind of like that idea, you know, that's creative thinking, because they can't just whip into a drive-through like we can with a big 18-wheeler, you know, so you have to think like that, you know, how are they being serviced? So I think that's very good, you know, very good. And it helps with business, the small business.
Yeah, and especially him, right? Because he's delivering flammable, you know, materials. And so he especially has to be very careful about where he puts his truck or stops off. And I mean, he has to completely set that up logistically ahead of time. So
their guidelines are a little different when you carry in hazmat. Exactly.
Yes.
So, and they can't stop, just arbitrarily stop, even where some of the other trucks are able to stop because of the type of products that they're carrying. So really good information. So remember, there's no vaccines at this point, and it's going to be a while before we get a vaccine, because there's 3 phases to any kind of vaccine trial. And you have to look at, you know, you have to take time, and safety is one of the big things that they have to assure, you know, as they're developing vaccines, and then efficacy. How efficient is this? So all of this is a process. It's not something that we can just, you know, tomorrow come up with a vaccine. And then you have to do a trial of a large population. So it usually takes anywhere from 12 to 18 months. And there's still no guarantee after that amount of time whether or not that vaccine is going to be effective. So, you know, right now we have to do what we can do as far as you know, with there being no vaccinations, no medication. Right now, it's all about us being vigilant in what we know, which is, you know, making sure that our diet, our immune system, all of those things are kept up to par, and that we're exercising and, you know, doing those things, that the guidelines that they've put out there, that we're working with them and not against them, because that's what's hindering our process right now when we start becoming lackadaisical. And that's why we're seeing our numbers grow the way we are right now here in this country.
One thing I will add when it comes to the airport, as far as the face mask we talked about earlier, I don't believe the airports, and I can't speak for other countries, but I don't believe the airports are doing temperature checks. So that's why it's so important, as Michelle mentioned, that we have to do our own homework. So if you know for a fact that you're sick, hopefully we won't have passengers traveling to the airport to take a flight, because again, I'm not sure if the airlines are doing temperature checks, and I haven't seen that anywhere, so I don't think they are. But that's something that we have to keep in mind. You know, why risk traveling when you're sick and you're just going to affect the other person on that aircraft?
Right. And understand, still 80% of the people are asymptomatic, so they may not even have a fever or anything, and they're you know, they can be infected. So we want to keep all of those things in our mind and ask ourselves, okay, what's the best way for me to travel, to do it safely, to, you know, make sure that I'm safe, but also make sure that the other passengers are safe. And that's by following the guidelines that we've talked about already. Next slide. And this is Dr. Corvett and her team. They're doing an excellent job in providing you know, as much information. Remember, coronavirus is a novel virus, meaning that it's a new virus. So it's not acting the way the other viruses did in the past. So that's why we're constantly seeing updates and changes, because this is new. It didn't exist before. So they're looking at what some of the other viruses did, and this one is taking on a whole different route. And some of the symptoms and all of those things that we're hearing about are different in comparison to some of the others. So the question is, where are you getting information? We want to make sure that you use resources that are viable, that's providing you with scientific or medical information, and not just relying on social media or the media. You want to go to these reliable sources. And so what we've done is we put together some information or resource links for you. And we started with both Stacey's Porter Global Security is there, Porter Global Security, as well as my website is there, Occupational Safety and Health, and then the risk assessment, and then some of the other global communities. And I'll let Stacey and Ashley talk about some of these with you.
Yeah, so I definitely wanted to provide links to these resources. You know, if you are looking at conducting risk and threat assessments, obviously go to the Porter Global Security to get more information and get in contact. I will have Stacey's information up after this. If you are looking at education and training, Michelle is an excellent resource for that, and her website is right there as well. If you are looking for a community of support, that of other like-minded individuals who are talking crisis ready and just mitigation and risk and just what's happening on a daily basis and what's the new change today and what are some people doing to take action and make change going forward. The Crisis Ready community is an excellent resource for that. It's a support network. And then some of the other resources that we have, I love the global timeline of reopening for travel, just because you can see, you know, what's opening and where, and you can filter it by region and by industry. So I love that resource. And then, of course, the industry guidance from ustravel.org. You can see what the tourism industry is putting in place to hopefully build your confidence and also provide you with some helpful information as to what they're doing specifically to help the tourism industry, you know, get back up and running again. And then, of course, OSHA has specific some airline industry information there at that one. And then, you know, the Johns Hopkins and the other COVID-19 projections are just interesting to kind of look at. I'm a visual person, so I love to see graphs and charts and things like that and how the numbers are working itself out. So those are just some good, solid resources to go to as well. This will be provided in the follow-up email, so you can either, you know, grab it from here or I'll be sending this slide deck to you. And then our contact information, we'd love to hear questions. Does anybody have any questions that came up throughout the webinar or anything specific? I know one of you said about traveling soon to Taiwan as soon as the flights resume. I would definitely recommend you keep an eye on that reopening of travel timeline so that you can see, you know, when that's going to be made available. They may already have something up there. I'll have to check that out. But anyone else have any other questions or just any side notes or anything that that folks wanted to share?
I see Ms. Ellaby has a question. Should we wear gloves when we're traveling? The issue with gloves is that it leads to a lot of cross-contamination. And so my stance on that is unless you're not going to be touching a lot of things, because understand that if you have on gloves, say I'm traveling to the airport and I have my luggage, I have my keys, my purse or whatever, you know, I shouldn't have keys, but my purse and my cell phone, and I touch something and then I go back and touch one of those items, I've already cross-contaminated. So the easiest way when you're traveling is to constantly wash your hands versus wearing the gloves. Because if you're going up the escalator, you're going to be touching that most likely, balancing yourself. And then once again, whatever you have on your person, are you going to remember not to touch that cell phone or touch your boarding pass or touch, you know, that increases the probability of cross-contamination versus just having, you know, no gloves and being able to constantly use that, use, you know, wash your hands or use your sanitizer. The only thing, just remember, because you're using a 60 to 70% sanitizer and you're using it more frequently, then your hands are going to be drying out. And you want to keep that moisture on your in your hands, on your body, because that's a natural defense mechanism. So when you start drying out your hands, they're more susceptible to something getting inside through the skin. So, you know, you have to be able to balance all of that. So in answer to your questions, my advice would be to limit the wearing of gloves when you're traveling and just increase the usage of washing your hands or using the sanitizer. And when you're washing your hands, you're doing the full 20 minutes, 20 seconds, I'm sorry, you're doing the full 20 seconds. Science has shown that 5 seconds won't do it, 10 seconds won't do it, but 20 seconds is able to kill the coronavirus when you're washing your hands.
And one thing I'll add to that, if you don't mind, Michelle, is as far as the wearing of gloves. You know, it's fine if you're going to get on the aircraft and you're going to wipe down your area. Again, they are wiping them down, but if you're not comfortable with that and you're giving some sanitizer, you know, it's fine if you want to wipe that down wearing your gloves. But again, you have to properly dispose of those gloves when you're done, and just be mindful, as Michelle said, touching things. Now, one thing I will also add, I know a lot of the airports, they're going to a touchless mechanism where you may not have to print out your boarding pass. You can use your phone. I know TSA, they're doing as much as they can not to touch a lot of your items. So most times now, when they have the liquid policy in place, you can do that now with your food, where you're going to be able to put it in clear plastic bags, and they're not going to be touching that. So just pay close attention to that. One thing you also have to keep in mind, things may be okay traveling now because they'll have the signage. They may have the voice notifications going on in and around the airport, and may not be as crowded. And that's right now because things are slowly reopening. But just keep in mind, as time goes on, that airport will start to fill up, as we've seen before. And that's where you're going to have to be mindful of the social distancing. Should I wear my mask, or should I wear the gloves? But you know, as Michelle said, you know, if you're putting on gloves from the time you get out your vehicle at the parking garage, as you walk into that airport, just keep in mind how many times you've touched so many different things while you have those gloves on, and then getting on that aircraft, touching your seat, touching the, you know, the luggage area where you store. So just be mindful of that.
And so when we do go to the touch list and you have those phones, you just got to make sure you got those extra battery packs. So, you know, like I said, it's a lot of planning in this, because, you know, otherwise you're going to be waiting in that common area to use those, the plug-in areas. And that's where a lot of traffic is a lot of times already. So just think through your travel, just, you know, try to walk yourself through what is it that I need? What is it that I'm going to use to keep myself, you know, keep the areas disinfected and keep myself sanitized and all of that kind of stuff. Just actually have a plan.
So you make a good point, Michelle, and I have a experience in the travel industry, and I work with a lot of travel advisors, and I think that it's overwhelming, right, to make all these plans. So it would be important to connect yourself with a travel advisor who is going to be well-versed in all of this information and how you can protect yourself and where should you travel and where shouldn't you travel and what places should you stay at and what places shouldn't you stay at. You know, AAA is a really good resource. They have great travel agents. But if you have, I would just highly suggest you find a good travel agent going forward, because we're in a new travel environment, and it is their job to be that resource for you. And it's not at any additional cost. You know, the tourism industry pays those travel agents through commission. So they're there for you. Utilize their services, you know, and just that's exactly why they're there, is to be that resource for you. I do see one other question here. Do wearing sunglasses and visual glasses help to protect your eyes?
Well, right now they're saying that any kind of glasses are protective. So yes, that's a very good question. And yes, that does assist in protecting your eyes.
As long as you're not touching them too much, right? You put them on, don't touch them, keep your hands away.
So that's our new norm.
On and off.
As you said, that's our new norm. We gotta just kind of keep your hands away from, you know how we used to tell our kids, keep your hands away from your face. So yeah, we gotta do that now. We gotta, you know, really watch what we're doing with our hands. And, you know, once we have our eyewear on and our mask on, we don't want to keep touching them, because then once again, there's a possibility you can get something in your eyes or your nose or your mouth, and, you know, and here we go all over again. So.
And you also have to keep in mind, although you have on glasses, you know, you still have those droplets, and those droplets can easily get in between.
Get past, so. Because the next question would be, well, do you recommend goggles? Hopefully we don't have to, you know, that's why you're seeing a lot of people that wear the face shields. And now those are readily available as well. You know, they're just the plastic shields that you wear. I saw one the other day that's made like a visor. It just kind of goes right around your head. And that may be something that, that's comfortable. You still have your mask on underneath, but now it's protecting that whole facial area. And so, hey, if that's makes you feel more comfortable, because that's close enough to your face, because it fits just like a visor would. So it's close enough to your face where it's covering, right above your eyebrows. And so I think that that's a better solution even.
Yeah. I'm just going to launch a quick poll. I'm interested in, where everybody's at in travel. So if you could just take a moment, I'm going to launch this poll and answer these couple of questions. We would love to hear your feedback. And Stacey and Michelle, you guys can go ahead and poll as well.
Okay.
Okay, we'll give it just another second for people to come on here. Okay, let me go ahead and just end that. Let's see if it will share the results. Can you guys see the results there?
Yes.
So what is your comfort level traveling within your community and or state? Looks like 25% are very comfortable, 75% are comfortable. Yep. And then what is your comfort level traveling outside of your state? See, I thought that might be the case, where it was like, leaning more towards the not so comfortable.
Yeah.
And then
interesting.
And then it's interesting.
Yeah.
It's interesting. As the vacation season begins, how concerned are you with others traveling into your state, right? And I was thinking that was probably going to be the case. So I've been talking with a lot of the leaders in the tourism industry, right?
Okay.
And they're trying to figure out how they're marketing their tourism, right? Are they marketing it to external, like they typically would, to say, hey, come into our state, we're open. But I noticed with the state of Arizona that they're actually doing a lot more internal state marketing, right? Like staycation, where, come and just get out of your house and come and enjoy us. We're doing all these things to keep it clean and safe and everything else. So it's definitely interesting. I thank you so much for participating in that poll.
Very interesting.
So I just want to, again, thank you so much, everybody, for participating. I hope this was very helpful. We are going to send out the recording. You see our contact information there. Do not hesitate to reach out to any one of us. We would be so happy to help you, point you in the right direction, or provide you with what you need. Again, thank you, Stacey and Michelle, for your time today. You know how much I truly appreciate each one of you. And I just look forward to, working alongside of you to get people into this new travel environment that we're going to be in. So thank you.
Awesome.
You're welcome. And one thing I'll add, this is our second webinar series, so we would like to keep this going. So those surveys are definitely important, because we want to hear your voices, and we'll know what topics we can attack more. I know one of the things we need to speak a little bit more on is the international travel. I know we can't, travel outside of the United States right now, but as we mentioned earlier, we do have people on this call, and I'm sure they have questions and information as to how things will look for them traveling within their country. So that's something that we can probably look at down the road as well.
Yeah, and I know we've gotten feedback about wanting to learn about where the event management space is going. What are events going to look like in the future? So there's more to come on that. We got some good experts coming up, and so just stay tuned for some of our upcoming webinar series. Thanks again, everybody.
Thank you.
Have a great weekend.
Yes, you too.
Bye.
Bye-bye.
Bye-bye.